February is American Heart Month. On this episode of Putting Possibility into Practice, we are getting heart healthy with tips for you and your family. Statistics show that heart disease is the leading cause of death for both men and women in the U.S. Every year, 1 in 4 deaths are caused by heart disease. There are things you can do every day to prevent heart disease, and our cardiologist has tips for you to be good to your heart. Plus, we'll learn about Monmouth Cardiology Associates and all they are doing to ensure great patient care every day. This is Putting Possibility into Practice, and it starts right now. I'm Joe Augustinelli, Social Media Manager at Greenway Health, and welcome to this episode of Putting Possibility into Practice. And I am privileged to be joined today by Dr. Brett Sealove, a cardiologist with Monmouth Cardiology Associates, as we celebrate American Heart Month with ways you can stay heart healthy not only this month but year-round. We'll learn more about the practice, their services, and resources for patients facing heart-associated risk. And thank you, Dr. Sealove, for taking time out of your busy day to join me for our podcast episode.
Thanks for having me, Joe. Pleasure to be here.
Let's first discuss the practice. For our listeners, where is Monmouth Cardiology Associates located? How many locations do you guys have? The size of the practice, how many providers, and some of the services that you offer to patients?
Sure. So we have 2 offices in New Jersey. Our main hub is in Eatontown, New Jersey, which is a brand new state-of-the-art facility which we built about 2 years ago. About 26,000 square feet, 34 or so exam rooms. We have about 25 physicians as of this summer in our practice, about 10 or so physician extenders, nurse practitioners and physician assistants, a slew of nurses and other, folks who work in different departments in our practice. So a pretty large practice. We see about 400 or so patients a day in the outpatient sector, all comers. That also includes our other office in Freehold, New Jersey, which has about 10 exam rooms. So we cover a large part of Monmouth County, which is in New Jersey, and a little bit of other counties who come up to see us. Our scope of services is pretty broad. We really do everything imaginable for a large cardiovascular practice, and that involves obviously clinical cardiology. It involves non-invasive cardiac imaging and advanced imaging, which is nuclear cardiology, echocardiography, CT, and MRI, advanced imaging. We do invasive procedures. We do coronary angiography and stenting and other also complicated procedures, which is what most people call structural heart interventions or procedures, where with small incisions in either the groin or the wrist, we are able to deploy or open valves, again, without opening up the patient. So we do that in our invasive arm as well. We have a pretty large electrophysiological division. We have 4 or 5 electrophysiologists who put pacemakers, defibrillators, ablations, again, complex electrical abnormalities of the heart. And we also focus on vascular medicine. We have a lot of medical diagnostic imaging and interventions that we do for the vascular disease or non-heart-related vascular problems. And then there's another side of our practice where we really focus on prevention and wellness. We have a research arm in our practice. We have a new division about the last year or 2 called cardio-oncology, where the world of cardiology and oncology intersect, and that is a pretty hot topic nowadays where a lot of oncological processes and diseases and treatments sometimes influence the heart. So we have a very large presence in our area. We're actually, I believe, the only private practice in our area with this well-established cardio-oncology program, and we have a relationship with very large cancer centers in the area for such. And then we also have some outpatient, heart failure initiatives and programs that we have in our practice. So that's a kind of a long-winded version of what we're able to do, and we do encompass kind of the wide breadth of cardiovascular diseases out there.
And outside of the practice, even with all you do, outside of the practice, you're very active professionally and personally, I hear. How about some of and we'll talk about your ties with the American Heart Association a little later on in this episode, but what professional boards and organizations do you work with?
Yeah, so I'm boarded in cardiovascular medicine as well as vascular medicine and vascular imaging. And with that, I'm also a member of the American Heart Association and a fellow at the American College of Cardiology, the American Medical Association, and a member of the Omega Alpha Medical Society. So involved in a lot of organizations and, keeps me busy, keeps me on my toes, but also keeps me pretty sharp and up to date of things I'd like to hope.
And yeah, that's great to hear. And let's start with the basics. What simple steps can individuals take towards living a heart-healthy life?
So, that's a pretty big topic. I could probably, talk about it for an hour or so. But I think if you take some context first before I answer that question, I think it's probably, a good place to start. And as you said earlier, cardiovascular disease accounts for somewhere near a third or a fourth of the deaths in the United States. And again, putting that in some context, about 2,300 deaths per day from cardiovascular disease, which is about a death every 40 seconds, unfortunately, from cardiac or cardiovascular disease. So in this, 20 or so minute interview, about 30 or so people will have died due to this disease. And so the numbers are staggering, and it is a disease that can affect us all. It is not an old man's disease. That's, an absolute misnomer and not true. And although obviously cardiovascular disease, as it's probably known to your listeners, increases with age, there really is no bias towards age, towards gender. There is a slight increased predisposition in African-American men. Nearly about 50% of non-Hispanic black males actually have some form of cardiovascular disease. But it is really important to start with the fact that it is very, very prevalent. So to begin, where do we start with living a heart-healthy life? I think it's important to realize that this has the potential to affect all of us, and there is no such thing as starting too early and learning these behaviors now. Now, again, I'm not a pessimist. I'm a half-glass full kind of guy, and, the news is not all bad. We have and can and have made some significant strides in making a dent in this disease state. And in fact, actually, mortality rates for cardiovascular disease have decreased over the decades dramatically for both men and women. But it's still the leading cause of death combined in the United States when you combine it with stroke. So we still have a ways to go. And I think the things that we all need to do, regardless of whether or not you're trying to prevent the disease from first occurring or to minimize the chance of it recurring, are actually relatively simple. And, we hear about this in middle school and high school and from our parents, but it's the cornerstone to cardiovascular disease. And I say that to my patients because although obviously medications have a tremendous role in our society, and I, in some regard push drugs for a living, it's all about lifestyle to begin with. So, the answer to your question, what healthy things can we do? The few that come to mind, the first I would say is eating right. It is absolutely known that we need to do a better job in the States about selecting the best foods and working on portion control. And it is really so important because over the decades, this has gotten out of hand and it's leading to a lot of disease states that affect us and affect heart disease. So, for example, if you were born 50, 60 years ago, for example, the chance of getting diabetes is about 1 in 100. And if you're born today, the chance is about 1 in 3. And why is that? And most experts would say, there's probably not a genetic alteration that has happened in, a half century. And it's probably due to our diet and inactivity. It's what we have done to ourselves. So these are really lifestyle disorders, in my opinion. And you could argue that 50% of some disorders that we pay for on a daily basis, including obesity and its complications, are due to these lifestyle disorders. So we really, really need to start here. And I think most organizations, including the American Heart Association, as well as even, Sesame Street and other organizations, have made a tremendous push to attempt to influence really our youth and our families, because it really does start in the family. It starts in the home, because these behaviors we know can begin between the ages of 3 and 5 years of age. So I think the beginning is eating right. And again, if you want to talk about our youth, for example, 40% of kids under the age of 10 eat fast food a day. I mean, the numbers are, again, just mind-boggling. And these fast food chains, have been shown to, almost all of them, 90 to 95%, not meet the basic nutrition standards from our Department of Agriculture. So, at the very least, we really need to start eating right. And the other things, which I'm sure we'll talk about a little more, is, normalizing your body mass index, decreasing obesity, high blood pressure, high cholesterol, alcohol in moderation, lack of smoking, more activity. These are the big hot button topics that, people have heard ad nauseum, but it really is the foundation to prevention. And that's where our resources hopefully will go and should go, both on the medical side of things as well as, the patient care of things. Again, I would just tell people that, when we talk about obesity alone, it's about 3 to 7% of our GDP is spent on obesity or obesity-related diseases. And given the United States GDP, that's some countries in the world don't have that kind of healthcare expenditures for anything. So, we're really talking about things that we need to start tackling on a preliminary level, because it's about prevention and not about really all treatment.
And Dr. Sealove, when we talk about two of the probably high-risk factors, high blood pressure, high blood cholesterol, how often should patients have both of those checked? And are there steps they can take to be proactive in keeping them in both healthy levels? I know you touched on some of that in your previous response with eating right.
Yeah, well, that question really depends on one's overall risk profile. That also includes, obviously, age and the level of disease. So, there are some guidelines about when to screen people for cholesterol for the first time. Often, the first screening is near 30 to 35 years of age, depending on most guidelines. And how frequent thereafter, again, depends on their own inherent risks. What about, high blood pressure? I mean, high blood pressure is known as the silent killer. And it is absolutely imperative that people intermittently check their blood pressures by their healthcare professionals or on their own. So it's a variable answer because it depends on the clinical situation. And I could tell you at least the items and things that you can do to try to be proactive with your blood pressure and your cholesterol are a few. As I mentioned, before about diet and fitness and wellness, and, minimizing excessive alcohol, taking chronic nonsteroidals, which a lot of folks take for pain. Those are two simple things that could falsely increase your blood pressure. Not falsely, but can increase your blood pressure, and we could, clearly modify things. Again, lifestyle interventions have been shown, meaning aggressive fitness, decreasing salt content can decrease your blood pressure by 5 to 10 points here and there, depending on how aggressive you do these things. So lifestyle intervention should not be minimized, regardless if you have high blood pressure. Again, to minimize the chance of you getting blood pressure and living a healthier life, or if you do, lifestyle interventions alone can lower blood pressure and cholesterol levels. So that's kind of my answer for that question, at least at the moment.
We talk a lot about prevention, but let's talk now with some of the warning signs. Are there specific signs and or symptoms of a heart attack or heart disease that people should be on the watch for?
Well, the simple and short answer is no. There is really no classic symptom that everybody gets. The classic, I have an elephant on my chest, crushing chest pain is actually felt by few. And more often it's in discomfort, it's a pressure. It presents with severe indigestion that someone's never felt before. Profound, inexplicable sweatiness, even breathlessness for no reason. So this is a very, very common disease, as we spoke about, and more often it presents with uncommon symptoms. So women, ironically enough, we don't exactly know why, have more of these atypical symptoms than men. But the answer really is you just need to be mindful of the classic things, mindful of some of the more uncommon things. But again, it's such a prevalent disease that we see uncommon symptoms every day, and realize that, one needs to be in tune with their body and say, wow, I feel something that I need a healthcare professional to explain to me and not take anything for granted.
And you talked a lot about nutrition and eating right. It seems like every day there's some new fad diet or diet that comes out. There are so many diets out there today. What diet would you recommend for the general population and to our listeners?
Yeah, it's a great question. And the answer really is, I get the question asked all the time in my office is, there is no one diet for everybody. Otherwise, we'd all be on it. And also these diets and these fad diets, as you said, it also depends on what the goal is. So if one's goal is weight reduction, that regimen may not be perfect for, let's say, minimizing another heart attack or stroke, because a lot of this could be based on cholesterol consumption, for example. So there really is no one diet, and you have to ask your healthcare professional, what diet do you recommend based on my conditions A, B, C, or all of the above? I think most people out there, if you're going to say, well, what diet is really good for my heart health, my weight, and overall, I think most experts would at least argue that one on the top of the list, on make a lot of lists, is the Mediterranean diet. So this is the diet that our friends overseas typically, use, and that's rich in the healthy oils, the good fats, really minimizes red meat. Again, mild to moderate alcohol consumption if one does decide to drink. Not avoiding of these simple sugars, and if you're going to have some sugars, they're usually the complex grains and carbohydrates, which have been shown to be, good for you.
And what other things can we do to modify, our life to maybe live a longer, healthier life?
Well, I think I highlighted some of them, but if the other thing that I didn't really expand upon is the aspect of fitness and exercise. And again, unfortunately in healthcare, as you and most of your listeners know, you see the doctor on average, the follow-up visit is about 7 minutes in the office, just due to how complex our medical system has gotten. So we don't often have enough time to talk about these things, and this is why I absolutely embrace the opportunity to do this. So what about when you see a doctor and say, listen, you really work on diet and fitness and exercise, and that comes and goes, and you're left with, well, what does that mean? So the American Heart Association and most recommendations from other societies say about 150 minutes of moderate exercise or about 100 minutes of intense exercise per week. So for someone who is somewhat sedentary, that's an enormous amount of fitness, right? So it's 30 minutes, 5 days a week or so of moderate exercise. So I tell everybody those are really the goals. And it may be okay if you take a 10-minute walk before lunch, 5 days a week as a beginning, as a start. These Fitbits, these, metrics, these biometric devices that we wear, these wearables, are really could help people get motivated to increase their steps and increase their activity. Again, this is just trying to get up and go. I mean, that is the campaign that, really we all need to be a part of. But the most important thing I would tell people is you have to pick something that you enjoy. Because this is no different than, a teenager that has to clean up their room. And, well, I'll do it, but these are things that people don't like to do. And thus, what happens with teenagers or kids is, those behaviors sometimes get forgotten. But if you could pick something you enjoy and not feel like it is a chore and feel like, wow, I want to go for my 30-minute walk before dinner because I feel physically better, mentally better. I know it's a good thing for my blood pressure, my cholesterol, my sugars. Then it's not a chore. Then you have made a positive reinforcement about exercise. And you are essentially getting hooked on exercise. And that's obviously what, the runner's high, the endorphins that we see. But that is really pivotal. Again, to really try to do some aerobic activity, ideally daily, and enjoy it and enjoy while you're doing it. And because it's a lifetime commitment. This is not a crash course of, 6 months of exercise and, I fulfilled the goal. It really is a lifetime commitment. And if you don't enjoy doing it, it's going to be really hard to continue.
And as we mentioned earlier, in addition to being in practice, you are also a board member of the American Heart Association. Talk a little bit about the ways that people can get involved in the ongoing fight against heart disease. Yeah,
the American Heart Association is a fantastic organization, obviously nationally, and it's obviously not the only one out there. But the AHA sponsors, major events in probably every area. And these events have been typically known to be heart walks and luncheons, which are fundraisers, but also awareness to the community. A lot of people don't know about the AHA that provides millions and millions of dollars of research. It's actually one of the leading research and funding societies in the country. It also deals with CPR training and also a tremendous amount of health advocacy. So, there's something called Heart on the Hill, and, people can get involved even with advocacy in trying to influence heart healthy policies in Washington. So the American Heart Association, you could do fundraising, you could do volunteering. Again, a lot of the AHA do fundraising and outreach awareness to the community in simple things, like we've discussed. But the breadth of what you can do within the AHA is vast, and I kind of encourage people to go online and see if there's a desire in your area to do things locally or even nationally.
Sounds great. Well, Dr. Sealove, I thank you for all the great information today, and best of luck with everything moving forward, both in the practice and with the American Heart Association as we go through American Heart Month and beyond here. Thank you again for being my guest on this episode of our podcast.
Many thanks, Joe. Really appreciate the opportunity.
And if you enjoyed this episode of Putting Possibility into Practice, I invite you to subscribe on your favorite podcast platform of choice. You can also catch up on all of our past podcast episodes by visiting the Knowledge Center on the Greenway Health website. Once again, I'm Joe Augustinelli, the social media manager at Greenway Health, and this has been another episode of our podcast, Putting Possibility into Practice. Thanks for listening.